One of the important questions that comes to is the mechanism of action or how these various monoclonal antibodies work, including elotuzumab or implicity. It's very exciting when you think about elotuzumab. We think of it traditionally like a Rituxan, where it targets the SLAMF7, which is expressed on myeloma cells, and it can target myeloma cells using ADCC or CDC, which is similar to what we use in Rituxan, so we're similar or understand that concept. But importantly, when you think about elotuzumab, it really starts stretching immunotherapy, because what we see is SLAMF7 expression on NK cells as well. And so NK cells are natural killer cells, are a normal part of our immune system. And what happens is you can activate these NK cells, which are responsible normally for killing other infections, other tumor cells, funguses, bacteria, and so they're part of your immune system. But what happens here with elotuzumab is you activate the NK cell, and in combination with lenalidomide, for example, use the NK cells to actually directly target and kill those plasma cells. So not only are you using ADCC and CDC to directly kill the plasma cells, but actually there's a dual mechanism of action where you're actually stimulating the immune system and stimulating the NK cells to actually kill the myeloma cells as well. So it's very exciting when you think about the various mechanisms, and they're all very slightly different between the different monoclonal antibodies. But importantly, with elotuzumab, what you see is not just the ADCC and CDC that we're used to with drugs like Rituxan, that we as oncologists are comfortable with. We're also starting to see other mechanisms, including activating the immune system, activating these NK cells to help kill those myeloma cells as well.
How does daratumumab work? What's its mechanism of action? These are drugs in a new category of antibody treatment. So these antibodies have a multitude of effects, both directly on the cancer cell, in this case the myeloma cell, but it turns out they have effects on other cells around the tumor that may be involved in boosting the immune system. And in fact, daratumumab was originally designed as a way to target the myeloma cell itself, since it bears the protein called CD38, and then it would go to it and enlist the immune system to kill the myeloma. We now know it's much more complicated in a good way. It actually brings along immune cells that can also help knock off the myeloma. So traditionally, it's been thought to work through a complement-dependent cytotoxicity. That's a well-recognized mechanism through antibodies, and an antibody-dependent cell-mediated cytotoxicity. And then a newer mechanism called ADCP, which involves the monocyte, the phagocyte, which is the cell that kind of gobbles up things. And that's kind of a newer mechanism. So there's kind of three mechanisms through which the drug is thought to work. But recently, interestingly, it's been recognized that the CD38 antibody also gets rid of cells that suppress your immune system. And as a result, T cells, which are a big component of a lot of immune-based therapy, now get increased. Now, it's kind of interesting that on the other hand, the CD38 seems to reduce NK cells, which has been the basis of the other recently approved antibody elotuzumab. So one could envision perhaps combining these two may be a good thing in a way to treat myeloma. But daratumumab basically is another monoclonal antibody, targets the myeloma and says, hey, come on along immune system and find me, and then this is hooked onto the myeloma cell, and as a result, you have less myeloma around. But now we know there's also an additional benefit, an added benefit, that it may help boost T cell responses. So we have two antibodies with targeting different proteins. We have the elotuzumab targeting SLAMF7, which is directly on the myeloma cell, and kind of counterintuitively is also on the NK natural killer cell, but that cell has an activation factor. So when it binds there, it activates the NK cell, and then when it's on the myeloma cell, together they dance and the myeloma goes away. Whereas the other antibody, the CD38 antibody, daratumumab, really is thought to target directly the myeloma and not have this additional impact. But now we know there may be actually some immune-based effects of that as well.